Hi guys, I will tell you removal timing of a hook plate for AC joint injury, not distal clavicle fracture. I have had the experience of removing the plate 2 months after surgery. The patient developed an infection, so after treating the wound with antibiotics but not perfect, it was finally removed at about 2 months. But there was no displacement of AC joint. Infection was healed after removal of the plate. So I recommend my patient to remove the plate about 3 months later from operation. I always do that like this. The tip of the plate usually excavate the undersurface of acromion by the repetitive motion of the shoulder. It is called osteolysis. Also, the distal clavicle can also develop the osteolysis. So I always tell my patient the reason why the plate should be removed. There are also papers saying about this. Delayed removal of clavicular hook plates, the effect on complications and functional outcome. This paper said delayed removal is 6 months later, but I always recommend my patients remove that plate about 3 months later from operation. Thank you.